Hello, welcome to another evening of Montgomery Heart and Wellness on Wednesday. I decided to go on live this evening because yesterday, many of you may know, I posted a couple of videos on the untimely death of Tito Jackson, who suffered a heart attack, and I talked about risk factors for heart attack. And we received a fair number of comments and questions on that. Lots of comments on the channel. We also received some email comments on our community. And so I decided to come on and do a discussion. So many of you may remember Tito Jackson died suddenly. And there was an interesting article. I won't review it today. It's on one of my videos. The links to both of those shows are in the description section. But I went through the symptoms that he had and how those symptoms were consistent with a heart attack. It was quite interesting how his friends described his appearance and the symptoms he had and the like. So I thought it'd be a good idea to come on live and address many questions and comments. I will start with this. So there were a number of comments and questions related to my comments on lifestyle. In fact, there's one person that came on and said, oh gosh, this what this doctor's saying is crazy. Lifestyle has nothing to do with whether you have heart disease or heart attack. There are lots of people that eat all sorts of junk food and they don't have heart disease. And there are people who exercise and run who are healthy who have heart attacks. And I want to make sure people understand that the point I made were generalizations. Now, there are many ways in which you can develop heart disease. A poor lifestyle, such as eating poor food, smoking, is the major way that most people develop it. People say, well, genetic factors are there, but the environmental factors are the most important. So the long story short is lifestyle has a big impact on it. And so you should be aware of that. And we have lots of scientific data that shows that in our practice, we actually show the reversal of these with heart disease, reversal heart disease with the changing of the lifestyle. So there's clear evidence that happens. And I just want to make sure people understand that. I want to say hello to everyone. Sheila Hawkins, Willie Lee Lump, Purity and Plants, Adam D. Nelson. Welcome to the show tonight. And thanks for joining us. Please feel free, if you have any questions now, feel free to enter them into the comment section. I want to bring on my director, Jackie Williams, who's on with me tonight. It's going to be helping out with looking for questions. Jackie, you have any questions from the audience or preliminary questions that people may have asked?
Yeah, well, so one of the questions is from one of the comments to the Tito Jackson video, and you touched on it a bit. So this commenter noted that the siblings of Tito Jackson have heart issues. And so do we get bad genes from our families, or do we get something else from our families?
So the genes determine how you get sick. So the lifestyle will determine that you get sick. So yeah, there's a genetic factor but some people are more predisposed to heart disease compared to others. So let's say, for instance, you get 1,000 people in a room and you give them all the same poor lifestyle, the bad food, sedentary lifestyle, and the like. A certain percentage will have heart disease. Another percentage will just get obese, diabetes. Another percentage will be thin, but maybe they'll have mood disorders like depression or anxiety. And another percentage will have some other disease. And then other people have a combination thereof. So lifestyle contributes to the mechanism in which how you get sick. But the genetics determine the mechanism, but the lifestyle brings you to that point of sickness. Another way of looking at it, if 100 people jump off a building or fall off a 3-story building, they'll all break bones, maybe different bones. They have bones that are weak. So they all have a broken bone. But if nobody fell off the building, nobody gets a broken bone. Even though they have weakness in different parts of the body, those weaknesses won't be exposed if they don't fall off the building. So the poor lifestyle exposes your genetic weaknesses.
Okay. Here's one comment from the chat. She says she likes your theory of juicing and eating, but I cannot fast for weeks. Can heart failure be reversed, in your opinion?
Well, we've seen evidence of heart failure being reversed. Now, we haven't done a large study to show it, but we have done case series. We see it routinely in our practice where when we use aggressive lifestyle interventions, people's heart function get better. We present a lot of these stories on our clinical rounds case series stories. For those who haven't seen our clinical rounds, we show discuss patients who come to our center with heart failure and various other diseases, and we show how these conditions improve or essentially reverse with aggressive lifestyle interventions along with other things that we do in our center.
Okay, thank you. One commenter asks or notes that Tito was a heavy smoker. So does smoking cigarettes, smoking anything contribute to heart attacks?
Yeah, smoking is unhealthy. It does contribute to heart attacks. Eating poor food might even be worse. No one's done a head-to-head study, but certainly smoking contributed to his heart disease. And I advise everyone to stop smoking if you do and not start if you're not.
Do you think that overwork and stress lead to a heart attack?
Those are all contributing factors, typically because, again, the body is going to have an adverse react to stress and being overworked. But I would say that if your body is healthy, you'll be able to tolerate work and stress better than if your body's unhealthy. So what you put in your body is going to be the most important thing because we cannot really adjust the outward stress. It's almost as though, think of it this way, if we all lived in a cold climate, and we had to go outdoors to do things, whether we go to work or whatever, we'll have to go into that frigid cold weather. However, those of us who put on an overcoat would tolerate the stress of the cold weather better than those of us who wouldn't, who don't wear a cap or shoes. The people who don't wear a cap or shoes will get frostbite. Those who are properly covered won't get frostbite. Similarly, for someone who has a fortified immune system, a fortified physiological system, if they have a tough job, a rough environment, they'll tolerate this environment much better if they're internally and physiologically healthy.
Okay.
Here's one in the chat about a mechanical aortic valve.
Oh, okay. Can I ask you this one?
Sure.
So, you've put it up. Okay, great. So any specific advice for someone with a mechanical aortic valve? This person's been whole food plant-based for a long time, and I'm quite aware of vitamin K. I take Coumadin. Anything that might help with valve longevity?
Well, eating a healthy diet, a whole food plant-based diet is healthy. Eating a healthy diet is going to help with the valve longevity. So that's really critical. So yes, eating healthy, exercising, taking your warfarin, monitor iron, all those things are important for valve health, and I think you're doing the right thing.
Okay. Purity in Plants asks, what form of magnesium is best for heart health?
We use a form of magnesium called magnesium glycinate. It's supposed to be absorbed more easily than other forms of magnesium. I recommend getting your supplements from a physician or natural physician who uses formulations that are high grade, high quality. Magnesium glycinate generally is one that is very good and very healthy.
Okay. Can a person with PACs take PDE5 supplements?
It depends on the cause of your PACs. And so I don't want to make a comment on that, but your supplementations, and also depends on other supplements that you're taking. So I'll say I don't know. It just depends on your specific condition and while you have the reason you're having PACs.
Okay.
Someone wants to talk about LP(a). Well, the
Can
question is flying in fast.
I'm sorry?
The questions are flying in fast.
Flying in fast. Can you talk about high lipoprotein A? What cholesterol numbers should you strive for and managing this condition?
Well, Lp(a) and the labs we use, and every lab may be different. Lp(a) less than 75 is good in our lab. We've actually published in the medical literature a defined plant-based diet can reduce Lp(a) by 16% in just 4 weeks. In fact, we did a clinical rounds where we filmed just today, and the patient had a very significant reduction in Lp(a), about 46%. So Lp(a) can normalize. Total cholesterol, you want around 150 LDL, less than 100 would be ideal, generally speaking, for the most part.
Okay. What about this one? With heart failure, what is the most important diet, exercise? I'm sure maybe diet and exercise.
What heart failure was, okay. Well, any form of aerobic exercise can be beneficial. Strength training is important. Things that improve your overall body's functionality. Cardiovascular health is helped by cardiovascular exercise, walking, climbing, those things. Flexibility is important. Really, exercise that improves strength, flexibility, endurance, those types of things are what you want to do and combine. The diet, we promote a heavy plant-based diet. When I say plant-based, you don't want to use processed food. So, if you're eating fried this or fried that, it doesn't matter whether it's a plant or not. Junk food is junk food. So when we talk about whole food plant-based, when I talk about fried stuff, seed oils, all the sugars and things like that. So you want to have naturally prepared food. That's why we use actually what we call a raw diet, or referred to as minimally processed, because these foods are going to be healthier for you, and they're designed in a way that the body can absorb them better.
Okay.
Someone's asking about hydrochlorothiazide. Do you have swelling after discontinuing use of hydrochlorothiazide, or why? Hydrochlorothiazide is an antihypertensive medication. It's a diuretic, so it can reduce swelling. I don't like to rely on diuretics for blood pressure or treatment of swelling, largely because they can also waste important minerals. So the simple answer to your question is because it's a diuretic, and some people can benefit from diuretics in reducing swelling, that's probably why they may swell after removing hydrochlorothiazide, is because it may be helping with the swelling.
Okay. What are your thoughts on statins? I don't have high cholesterol and was prescribed it, but I hear more bad than good on taking them. I was prescribed atorvastatin.
Yeah. I'm not a big fan of statins, and it's weird to say. I'm a cardiologist, and I say that, but I say that in the open. If you look at the absolute risk versus relative risk, there's very little absolute risk reduction when you take statins over a long period of time. Many of these drugs was tested in studies that lasted, say, anywhere from 2 to 6 years, but you don't know the adverse effects of a statin drug that's used for, say, 10 years or 13 years. And so the adverse properties of a drug may overweigh the benefits. That's one. Two, there are excellent ways of lowering your cholesterol or improving your metabolism without statin drugs.
Mm-hmm.
And so I don't like to use them. We will refill them sometimes if people don't want to do the right thing. And they're on it, but it's not the first go-to. There are also supplements that you can use that can also help with your cholesterol.
So this was not in the chat. This was in the comments on YouTube. Mr. Jackson might have had symptoms preceding his heart attack. What symptoms warn us of an upcoming heart attack?
That's a great question. And in my second video that was posted, I talked about some of the warning signs. And chest discomfort could be one of those symptoms. In other words, he may have had chest discomfort that was milder. He may have had shortness of breath. He may have had fatigue, low energy, sometimes sweating at night. So there are a lot of symptoms that we can have that are mild, and these are symptoms of heart disease, and oftentimes we brush them off. The interesting thing about the symptoms he had when the heart attack came on, it was so severe, it stopped him in his tracks. And it was interesting how they described it. He just stopped doing what he was doing and said, hey, I'm having problems in my chest. And he was sweating profusely. So he may have had the same symptom, but just milder, to the point where he just brushed them off.
Okay. should I continue to take blood pressure meds if diet and exercise control my blood pressure?
In our practice, we don't prescribe blood pressure medications in individuals who control the blood pressure with diet and exercise. I'm not going to give medical advice, but I try to put individuals or place individuals on a diet and exercise regimen so the blood pressure comes down naturally and the medications come off.
Okay. What about PVCs?
Lots of things can cause PVCs. If you've had a heart attack, you have scarring in your heart. We commonly see them with electrolyte abnormalities. I mentioned magnesium deficiency is a common cause for it. Anything that can put your body in physiological biochemical imbalance can cause it. Scarring in the heart, we tend to have good success by correcting electrolyte abnormalities such as magnesium, sometimes potassium, and suppressing PVCs.
Does vitamin D3 plus K2, is it good for the bones or for the arteries?
Yeah, it's good for both. I mean, vitamin D3 helps with calcium metabolism, which again is a major mineral for bone and bone health. And K2 is excellent for blood vessels. In fact, both of them are good for blood vessels because the vitamin D3 is more of a hormone. It's more like a hormone than a vitamin, and it's naturally occurring in the body. And I encourage everyone to get as much sunlight as you feasibly can so you can make as much natural vitamin D3 that you can. Most of us are not able to get out because of our work and lifestyle, but D3 is healthy for bones, but also blood vessels and overall cellular metabolism, the immune system, and various other things.
Okay. So Cece is asking, how long can an obese female, 241 pounds and 5'8", with no other health issues, go with eating a fresh fruit and raw veggies diet? I'd like to lose my sugar craving and lose weight. Exercising 4 times a week.
Well, you want to go as long as you can. When you want to make definitive change, what I recommend is that you choose a finite period of time, do an aggressive diet. We have nutritional protocols. We typically use 4 weeks. It's kind of an arbitrary number. We've had success with this approach for more than 2 decades. And we'll have individuals do a defined plant-based diet 100% for 2 weeks. And we'll monitor their progress and wean their medication or the like for that time period. And what that does, it gives you a time period you can focus on. You're not worried about the rest of your life, but you're worried about just that 4 weeks. Get to that time period. Once you've gone through the time period, you go back and reflect on the success you've had. You also get changes, your taste buds change, and you actually change pretty much forever. It's just a matter of then you can create a long-term strategy after that. You can also repeat this 4-week cleansing phase. So this is something that we use 4 weeks. It's arbitrary, but we found to be successful. You use shorter or longer period of times, depending on what your needs are.
Okay. Robbie asks, what are your thoughts on using Jardiance for heart health?
So Jardiance is a medication been shown, originally designed for diabetics, but studies have shown to benefit individuals with heart disease, particularly heart failure. I don't particularly go to this drug for heart failure patients, and I'm not criticizing those who use it. The data is there. Can we scientifically show a benefit there? Sure. It may have sort of a diuretic effect, and it's shown to be beneficial. But again, I try to use fewer pharmacological agents for heart failure patients, not more. So we have used it, I've had patients with it, but we'll either use it for a short period of time or not at all. My overall opinion on medications, they should be used for a short period of time or intermittently as needed. They shouldn't be, for the most part, lifelong chemicals that we consume. Now, there are exceptions to this. I'm not saying that's for everyone, but I think for the most part, we should try to use them sparingly.
Okay. Armors asks, can compromised heart function affect eyesight?
Well, yes. I mean, heart function is responsible for blood flow throughout all of the body. And so poor circulation of the eyes can be contributed to or made worse by heart function or poor heart function. So yes.
Okay. What's your thoughts on varicose veins removal if you're overweight?
I would lose the weight first and foremost because, and when I say lose the weight, I mean do it with aggressive lifestyle approach, unless you're having such severe problems with the varicose veins and you have to address it. But the reason I say that is because, we've had people with varicose veins that go away with healthy lifestyle. So you want to try a healthy approach first and foremost, minimize the use of medications and procedures. So aggressively go with health and lifestyle first and foremost, pills to procedures after that if you need help, if your lifestyle isn't enough. Most of the time the lifestyle is enough, but if you're not able to, comply with aggressive lifestyle, then you may need to get some help. But I would start with the weight loss through lifestyle first.
Okay. One commenter says that she wants to get an appointment, and how can she do that? You can go to the website. The phone number is on the website. It's 713-599-1144, and they will take your information, your insurance information. Dr. Montgomery accepts insurance and Medicare, and we would love to have you make an appointment. So please do that tomorrow.
They can also sign up for an assessment call, right?
Yes, they can also sign up for an assessment call, which you can do on the website.
Yeah.
By the way, there's a time tomorrow morning. So if you would like to join the assessment call tomorrow morning, somewhere, it depends. It's somewhere in the range of between 9:30. I don't have the schedule in front of me, but you can join an assessment call tomorrow morning. Go to the website, look for the assessment call, sign up for the one tomorrow morning.
58% is a good number for ejection fraction, but there are a lot of other things that go into heart function and ejection fraction, but 58% is a good number.
Does poor metabolic health increase the risk of having a heart attack?
Yes, absolutely yes. That's the case with diabetics or people with high cholesterol, people with obesity, those types of things. So absolutely. Now, here's somebody, this is interesting. What is this? EF for 10 to 15% completely off meds except Lasix. I've been hearing that I need to continue Entresto in order to improve heart function. Is this the only path? I don't want to answer your specific question. However, what we've done in our clinics that and there are a lot of other treatments we use to improve heart function. So we have found paths other than Entresto and medication and people with low ejection fractions who choose not to be on medications. But that may not be the case for you. So you have to get with your doctor on that and see if they're willing to work with you on changing your lifestyle or choosing some other path. Well, yeah. Can PVCs be reversed? Yes. If it's due to lower electrolytes and magnesium, then yes, you correct the electrolyte abnormality, the PVCs go away.
Okay. What if you're told you have a calcium score of 174? Can it be reversed or improved?
Well, the calcium score can improve. What you want to do is know that, okay, that showed you have some risk of having coronary disease. And the more important thing in reducing the calcium score itself, which is just a number, is to make sure you take account to your lifestyle, make sure your blood pressure is under control, your inflammatory markers under control, etc., because those are going to be important things, because calcified vessels tend not to increase the risk of heart attack, but the ones that are soft plaques that are ones, so you have a 0 calcium score, but still have soft plaque that can rupture and cause a heart attack. So it goes down to what your underlying biochemistry is, and not with one score or another score. It's calcium score of 500 versus 0. A person with 500 can have a heart attack. A person with 0 calcium score can have a heart attack. So there are other factors that are involved. So yes, it can be reversed or improved, but more importantly, how you do it is going to be critical.
Okay. Sonia on Tiny asks, do you still work with heart patients?
Yes, we do.
Yes. All right, I'll let you read that one. I have a completely blocked. Go ahead.
Completely blocked right atrium or RA and disease left LA, which cannot be bypassed or stented. So basically, completely blocked right artery and a diseased left artery cannot be bypassed or stented. Can any other techniques work? Whole food plant-based diet. It depends. It's total cholesterol, feed LDL, 88. Well, I think you're doing that. If you're on the whole food plant-based diet and those cholesterol numbers are good, that's great. It depends on the effects. Your body will create natural bypass for these vessels. We use infusion therapies such as chelation and plaquettes to help open up these arteries. That's a natural way of doing. Infrared sauna therapy is also very helpful. If you have small vessel disease, that will help with that. So I would say, natural lifestyle, whole food plant-based diet, infrared sauna will help. Check your micronutrients and make sure you're correcting those things. Your vitamin D levels need to be under control. Magnesium levels need to be normalized. So check your micronutrients, and then infrared sauna and exercise are all important.
Okay. Do you need statins if you have stents?
My opinion is no. Again, it depends on the circumstances you have, but I have lots of patients who are aggressive on their lifestyle and they do very well without statins, even though they've had stents in the past. So it just depends on your circumstances.
Do your patients get basic labs, which include genetic testing for heart disease?
The only genetic testing we'll do is an ApoB test and an ApoE. And so we look at the alleles of the ApoE, and if you have like a number 4 allele, that shows you have increased risk of it. We used to have a test that looked at epigenetics. That company went out of business. But for the most part, we look at just basic biochemistry, micronutrients, and the like. Genetics, we pretty much know that, if you have a family history of it, you're predisposed to it, then you like to have the genetics. And we're not going to be changing the genetics, we're changing the epigenetics. So while it's good to see it, interesting to see it, there are some specialized heart diseases, arrhythmias, and things that we can check genetics. It may be helpful, but for the most part, we don't.
Okay. Marcia has plaque in her arteries. She's on Lipitor. Her cardiologist wants her to take Zetia. Also, yep. I'm afraid of all statins because I have chronic kidney disease stage 4 with a fatty liver.
Yeah, that's a problem. Zetia is a medication that's known to have an enhancement effect of the statin drugs, enhances benefit. So frequently doctors will add Zetia to a statin drug to improve the amount of LDL lowering. So that's probably what that strategy is about. We see lots of patients who have fatty liver and chronic kidney disease. You need to look at the entirety of your lifestyle. So you have to make aggressive lifestyle changes to improve your overall health. It's not enough to say, well, okay, I don't want to take a statin, but you may not be eating healthy. You're eating processed foods or sugars or lots of animal protein, or fried this or fried that. So you have to be aggressive on the lifestyle side and allow your body to naturally lower the cholesterol and improve even possibly the kidney disease or reverse the fatty liver. If the cholesterol comes down with your lifestyle and your cardiologist sees that, they may be less pushy with the statin drug.
Okay. D. Islan Hapa says, my appointment with Montgomery Heart and Wellness is scheduled for next month, and I'm anticipating meeting you. That's wonderful.
I look forward to meeting you also. Yeah.
So you talked about Jardiance earlier.
Yep.
And it affects heart health. Does it affect heart failure as well?
It's commonly used for heart failure. I don't use it for heart failure because I think that, again, it's one of the many drugs that have been brought on the market for heart failure. If you absolutely need it, you can add it. There's been scientific evidence showing it benefits heart failure. Mm-hmm. My personal opinion and philosophy is that we need to use fewer medications, not more. Every time there's a study showing a new medication having benefit, many of my colleagues just sort of randomly add it to the list. And I don't use that approach. I'm more targeted my approach in terms of using medications. I try to use few medications as possible and use lifestyle aggressively. We've had lots of success. We've published case series and actually studies. We've done, controlled studies which show that an aggressive lifestyle can lead to significant reduction in medication and better, outcomes in terms of blood pressure control, weight control, and improvement in biological markers.
Okay. Is red yeast rice safe for cholesterol reduction? What about niacin? Because she doesn't want to take statins.
Yeah, lots of people use red yeast rice as a supplement, and niacin can also be beneficial. It depends on the specifics. Again, I like to try to do it without a supplement or a prescription drug. It just depends on your specifics and how the approach you take in controlling your cholesterol. And keep in mind, the body makes cholesterol for lots of reasons. So, again, we make a case-by-case decision as to what the person's cholesterol number that's okay is. I gave you some random numbers, 200 for the less than 150, that's for the total, or less than 100 for LDL. But that doesn't apply for all of my patients. So I evaluate the patient and look at that patient's condition, and I'll make an individual decision. So I don't just apply those numbers. I don't treat numbers, I treat patients. We help patients get better. We don't just focus on helping numbers get better or numbers get lower or higher. And I think that's an important thing to understand. So I can't, make that, global decision where you should take yes or that, because it depends on your situation. My attitude is that we try to keep you as healthy as possible on the fewest medications necessary, and then you go from there.
Okay. Is it safe to exercise with TTR amyloidosis? Blood pressure is high, but heart has thickened due to not knowing I had it until it was discovered through echocardiogram and then genetic test.
Yeah, this amyloidosis, infiltrating amyloidosis. For the audience, this is a disease where the body's cells, essentially what cause that, inside your cells, you have proteins, and when those proteins get used up, just say like inside your house, you use things up, old receiver or something gets bad, you put it in the trash and get rid of it. Protein molecules that function inside your cell become old and worn out, and how the body processes and metabolize those things become abnormal. So sometimes they get released in the blood, and so you have these abnormal protein folds. They can then be infiltrated inside the heart muscle. In fact, it's interesting because the same like amyloid type molecules that can be deposited in the heart that causes cardiac amyloidosis is often seen in the brain associated with Alzheimer's disease. So this overall underlying adverse protein metabolism or protein breakdown can be seen, and that's where the foundation for amyloidosis. There are two different types. So clearly, depends on the specifics of your condition. We encourage everyone to exercise. Our amyloidosis patients exercise successfully. We use aggressive lifestyle intervention. There are some medications that are beneficial to this, so we use a combination, but things like infrared sauna, reducing inflammation. Inflammation is a big contributor to amyloidosis, and so you want to do a lot of things to reduce inflammation in your body.
Sharita says, Sharita, I do too. She has white coat syndrome. Every time she goes to see the doctor, her blood pressure is always elevated. At home, with testing several times a day, it's normal. I want to stop taking losartan. Can I do it safely? So what should she listen to? The blood pressure in the office or the blood pressure at home?
Yeah, well, the one in the office is always going to be an activity blood pressure level. So, boost your exercise and those things. Time restricted eating can also help the blood pressure. You want to lower it so much that your white coat blood pressure is in normal range or only mildly above normal range. So, my argument would be to work hard on the lifestyle side, and then work with your doctor on maybe weaning it or changing it one way or the other.
So Robbie asks about Jardiance and heart health. Robbie, that was asked and answered. So just watch the recording of this video and you will get the answer to that question. Do you recommend having an angiogram?
Only if you need it. I mean, it depends. The most obvious indication would be if you're in an emergency situation or an urgent situation, what we call acute coronary syndrome. You're having chest discomfort and you're short of breath and you're in the throes of a heart attack, or you may be in the near throes of a heart attack. That's when an angiogram is most beneficial. There are other times when it's beneficial too. It all depends on the specifics of your clinical situation. So we tend to be, judicious in our recommendation of angiograms. We do lots of non-invasive testing first. Of course, there's a lifestyle evaluation, but angiograms have their place and it can be important tests in the right setting.
Someone is having negative reactions to Ozempic. She says it causes lethargy and muscle and body aches. Is there a fix?
Yeah, stop the Ozempic. I'm not a fan of these Ozempic. These medications are called, GLP-1 agonists. The mechanism, the main mechanism is slowing gastric motility and creating increased satiety so that you eat less. There are other mechanisms too. And so they are used for people with diabetes and also contributes to weight loss. But again, there are healthier ways of controlling diabetes and losing weight.
Can heart thickening be reversed?
We've seen regression in heart thickening in our regimen, and heart thickening is frequently contributed to by inflammation. And we did a case series of heart failure patients. We saw a very significant reversal or regression of heart thickening.
Is CoQ10 good for heart health along with lifestyle change?
We use it as a target fashion for individuals with congestive heart failure or who have a deficiency in CoQ10. So the answer is yes. It improves mitochondrial function. Mitochondria are the organelles inside the cell that helps the cell produce energy. Think of it like the battery of the cells. And the CoQ10 helps with mitochondrial health and function.
Are you aware of any relationship between heart health and chiropractic adjustments?
I am not specifically. I haven't read studies on this, but I've known some chiropractors who swear by it. So that's something we'll look into. We do refer patients to chiropractors for their musculoskeletal problems. But yeah, we use that quite a bit. I think we have time for maybe 2 more questions.
Okay. I have a completely blocked right coronary artery and diseased left coronary artery. Can another technique work? Oh, we saw this before, didn't we?
Yep, because I just abbreviated the first time.
Yeah.
Again, your diet you're doing the right thing there.
Okay.
I think we've covered just about all these, right?
Yeah. Can you make some of your healthy foods available on DoorDash and Grubhub?
We do have a delivery in our city, and so we have a system that is actually less expensive than DoorDash or Grubhub. So you go to Garden Kitchen, gardenkitchenfoods.com, and you can order online, and it gets delivered to you. And now there's a difference in the price depending on how far away you are, which is the same as DoorDash. But we actually have a system that utilizes, I think, DoorDash or Uber Eats, but it's internal to our system. So we have it's available for delivery.
Okay.
So these are all fantastic questions. So what? One more question will close out. This has been a very, very enlightening group with great questions.
Yeah, they're fantastic.
Furosemide for leg swelling. How about that one to finish it out? Furosemide for leg swelling. That's a great question because I used to, well, I still do, obviously. I teach my physician assistants and sometimes I still teach medical doctors in training. You want to make a diagnosis before you prescribe a treatment. So this is a great question. The reason I like this question because it asks about specific treatment relation to a sign or symptom, swelling. So swelling by itself is not a diagnosis. It's an outward manifestation of an underlying problem. So the question I would ask, what's the cause of swelling? There are lots of different causes of swelling. Someone may be severely volume overload because they have heart failure and lots of swelling, or maybe short of breath. In that context, I'll use furosemide. But again, I use it in a target fashion until we get the heart failure under control. There may be some other conditions with swelling that I may use furosemide. But some people may have swelling because of inflammation, or they may have swelling due to venous insufficiency. So it depends on the underlying cause, because if you're treating this, and even if they have swelling, you give the furosemide, swelling goes away. If the underlying cause is not related to being fluid overload, that person can become dehydrated intravascularly or inside the blood vessel, and that can have an adverse effect on other things. Also, furosemide, like other diuretics, can waste electrolytes like magnesium and other types of electrolytes. And so you want to be careful with treating someone with a diuretic just based on a outward sign or symptom, but you want to make a diagnosis first and then apply the appropriate treatment based on your diagnosis. So great question. And of course, all the questions were great. And again, we hope we helped you out a lot this evening with our discussion. And we plan to do more of these in the future. I do want to point you to certain programs you have. Go to montgomeryheart.com is our website. It shows you lots of different programs. We have a link in our description for this show. There's a Jumpstart program which helps you detox. There's a more extensive nutrition program called Nutritional Rebuild. I invite you all to look at one of those and try them out. As Jackie pointed out earlier, you go to our website if you want to make an appointment. But we have an online community, so you don't have to come and see us in Houston. You can join the community. And exactly what I'm doing now is what we do in the community on a regular basis. And we have all sorts of wonderful questions. And it's our way of helping educate patients and empowering them to improve their own health. You may not have to see a doctor, every month or every quarter. If you have the right information and knowledge, you can apply that and then use your medical professionals as consultants to help guide you along the way as you take control of your own health. And that's the approach we take our patients. So hopefully this has been helpful to you. And I thank each and every one of you for joining us, and thank you for those great questions. And we will do this again in the not too distant future related topics. So anyway, thank you very much, Jack, for all your help. And thank you all, and good night to everyone. And we will see you in the next video.